It is Medical Monday here on KRDO News Channel 13 with our own Dr. John Torres. Good afternoon.
Good afternoon. How are you guys doing today?
Great.
Great.
Excellent.
Yeah.
It's great to see you guys
weather,
too.
can't complain.
No aches or pains?
No, nothing. Well, I do have a sore shoulder.
There you go.
We can talk later. Hey, these days, of course, a lot of over-the-counter pain medications available. It can be hard to choose the right one. What's your advice for everybody?
And it depends on what you're choosing it for. You know, we've all experienced those symptoms at some point. A terrible headache, stuffy nose, muscle aches. But which over-the-counter medicine works best for you? Well, brands like Tylenol are popular acetaminophen, and they're best used to ease pain, treat a headache, or lower a fever. But you, as an adult, you shouldn't take more than 4,000 milligrams per day. Ibuprofen, on the other hand, is an anti-inflammatory drug that works by reducing irritation of nerve endings. So when it comes to treating menstrual cramps or arthritis, we'll try a brand like Advil or Motrin or a generic non-steroidal anti-inflammatory. And when seeking relief from mild to moderate muscle aches, colds, or even headaches, well, aspirin is another anti-inflammatory choice, but you have to be careful because it can cause you to bleed. The key is to find a treatment that works for you, and if you're at risk for heart, liver, or kidney disease, talk to your doctor before taking any of those medications because they basically affect different parts of organs in your system. Now, if you want to try an alternative type of pain relief, some options, of course, acupuncture works great, yoga, exercise, and what's called cognitive behavioral therapy, where it's basically you're talking the pain down.
Yeah,
so
it's interesting to see how much activity can actually replace the need for some of these drugs, too.
It can, but you have to kind of break through that pain and the activity sometimes. That's the tough part.
Yeah. Another question people have, if you're at your desk 9 to 5, even longer than that, trying to find time to exercise, you know, it can be tough, but we understand it's critical. However, you may not need to exercise as long as some have said, or do you need to exercise more?
No, that's the point. You don't need to exercise as long as most people thought you did. Now, past studies have shown that long periods of sitting and TV viewing are linked to an increased risk of early death and chronic diseases like diabetes and cancer. But new research is revealing that not only that regular exercise could cancel out these ill effects, but it might not even take that much of it to do your body some good. Researchers analyzed data from 16 studies, including more than 1 million people, finding that getting as little as just 1 hour of physical activity a day could eliminate the increased risk of dying early linked to all that prolonged sitting. Now, the best results came with 60 to 75 minutes of moderate intensity physical exercise. We're talking a brisk walk or a light jog. So for the sedentary among us, remember that it doesn't take much activity to improve your health. If you have an hour, that's enough time to get out and get moving and get your health back in shape there.
Good reminders there. Okay, so more science is backing up breastfeeding and the positives according to that study. Breastfed preterm babies may have better IQs, working memory, motor function. That's all according to this new study.
And the benefits go on and on. We're learning more and more. But this study, led by Brigham and Women's Hospital, followed 180 preterm infants from birth to 7 years old. The results showed that the preterm babies that received more breast milk within the first 28 days of life had larger deep nuclear gray matter volume of their brain at full term, and that meant better IQs, academic achievements, memory, and even motor function by the age of 7. Now, according to the Centers for Disease Control and Prevention, breastfeeding rates are rising in the United States. With all the known health benefits of breastfeeding for infants, children, and mothers, the CDC says it's a key strategy to support mothers in initiating and continuing breastfeeding through professional lactate supporting, have those breastfeeding rooms they can go to, and please don't give a mother a hard time if she's breastfeeding out in public. That's natural.
It seems like that, if we're still talking about this, it seems like that should have been settled long ago.
You know, you think it would, and it's one of the best
Still an
things you
issue.
can do, but it still is an issue. Yes, it is, unfortunately. So.
All right. Always great having you here.